We have 7,000 patients who are undergoing what we call continuous dialysis or lifelong dialysis. Most of these patients are struggling. Most of these patients are struggling because they have to be supported. They have to be supported by other hormones to make sure that they are living quality lives. So often, sometimes the conditions for dialysis itself, as much as it sustains life, it may not provide quality life for these patients. And we are keen as a Ministry of Health to ensure that we transition these patients from lifelong dialysis, where they have to travel every 2 days, sometimes 3 days. And as you know, even though we have more than 47 dialysis centers in each of every county by the public sector, sometimes people have to travel for a day or for many hours, and you know the conditions of our transport. And so we are keen to make sure that we are giving these patients quality life so that they spend time going to work, not going to seek care. The second reason, which is very key for us, is an economic reason. We spend 1,107,000 shillings every single year per patient on dialysis, because we do 2 sessions per week for 52 weeks. Each of these sessions are around 9,500. If you multiply that, our social health authority and the predecessor, the National Health Insurance Fund, pays 1,107,000 shillings every single year per patient. That's around 7 billion that we spend on dialysis only. And so for economic reasons, it also makes sense that we, from a policy perspective, support our hospitals, all our hospitals, to graduate to be able to offer transplant services. We have met with all the CEOs of the referral hospitals, and we have appealed to all of them and identified areas where we all have to join forces together so that the services that you get in this hospital are quality, but the same services that you get in Kenyatta National Referral Hospital, Moi Teaching Referral Hospital, Jaramogi Oginga Odinga Referral Hospital, and the support that we give to county hospitals is all the same, so that we are not crowding the referral hospitals when other hospitals could support us in service delivery. So today we want to thank you so much, and we want to invite Kenyans of all walks of life that treatment is now available locally. We discussed with the CEOs of all the referral hospitals. We are targeting that within 1 year we could do up to 200 transplants, and then look at how to scale that up to other hospitals as we make sure that our systems are okay, the donor management issues, the recipient management issues, the hospital systems in terms of the theater conditions, the availability of medication for post-transplant. And we are very keen to make sure that we are moving progressively